Every woman should know about breast cancer, because it is one of the commonest cancers in women, and it is a common cause of cancer-related deaths in the world. So, in this video, let's talk about facts every woman must know about breast cancer, because early identification is the key to successful treatment, and the responsibility is in your hands. Who gets it? It is common in the age group of 35 to 75, and very uncommon below the age of 20. A woman's lifetime risk of breast cancer is around 1 in 9. What are the risk factors? Number 1 is female sex. It is 100 times more common than in males. As mentioned before, increasing age is also a risk factor. Family history of breast and other related cancers is one major risk factor. Especially, if your mother or sister had breast cancer, then you are at risk. Women who started menstruation at very younger ages, and women with late menopause are at risk. Nulliparity, which means having no children, and having not breastfed your children are also a risk factors. So, you have to understand that having children and breastfeeding are protective against breast cancer. Oral contraceptive pills and hormone replacement therapy are associated with breast cancer. Also, alcohol consumption plays a role. Now, let's talk about symptoms and signs of breast cancer. They commonly present as a lump in the breast, which feels hard and irregular. Usually they are fixed and immobile. Most of the time there is no pain. But rarely, some women will experience pain. Also, changes in nipple, like nipple retraction occur. Some women will experience a nipple discharge which can be blood-stained. Also, ulcers in the skin and changes in the appearance of the skin to look like an orange peel are seen. So, why should you know these? Earlier you identify a breast cancer, more successful the treatment. Therefore, every woman is advised to do self-breast examination regularly, to identify any lumps or changes in skin, at early stages. It is an effective preventive method. If you have a breast lump, what should you do? You must visit your doctor as soon as possible. Breast cancers are managed by surgeons. Your doctor will do something called triple assessment. First, a clinical assessment is done. This includes taking a history and performing an examination. Then, imaging studies are done. Usually this includes an ultrasound scan and a mammogram. Depending on your age and other factors, your doctor will decide what investigations are required. Third step is a biopsy study. This includes a fine needle aspiration cytology or a core biopsy. Also, depending on the findings on those investigations, your doctor may have to do other tests like MRI scans. Depending on how advanced the cancer is, treatment options are decided. If it is early breast cancer, surgery is done to remove it. There are two main options. Sometimes, the whole breast is removed, known as total mastectomy. Sometimes, the surgeon can remove a part of the breast, known as wide local excision and breast conservative surgery. In advanced breast cancer, if it has gone to other parts of the body, usually chemotherapy and hormone therapies are done. Radiotherapy also has a role to play. The medical team will decide the best treatment option, depending on the patient's condition. You have a role to play in early identification of breast cancer. For this, as mentioned before, self-breast examination as a screening method should be practiced. Women are advised to learn the technique and do it regularly. Also, you can get screening mammograms done, if facilities are available. Also, remember, if you have a family history of breast cancer, discuss it with your doctor and assess your risk. Sometimes prophylactic mastectomies are done for prevention in high-risk women. Hope you found this video to be helpful. In this channel, you will find more informative videos related to women's health. Watch them also and learn important health tips. Please like the video and share it among your friends. Subscribe the channel for more videos like this. Leave a comment below and let us know your suggestions. Thank you.